Welcome back to the show. We're live from our Michelin on Main TV studios. We have Dr. Nickles joining us, and we're going to talk about dentistry, obviously, because that's what you do. And I've told people, I've got the social media in front of me, and you're so good at answering questions.
Well, thank you.
So
I appreciate
if we happen
that.
to get a question in throughout the morning, we'll do that
It is
as
true
well.
you know the tooth fairy personally?
Absolutely.
That was Jack's question.
I thought you told me that one time. Dan?
So he's about to practice every night to pick up the spare teeth.
Well, welcome to the show. You always bring good topics to us. I think we need to be caught up a little bit on the new procedures.
Sure, absolutely.
What about implants? I know
Implants,
those. We still don't feel like that's something we know a lot about.
You know, I feel like we're 13 years into the 21st century, and I keep talking about 21st century dentistry.
Right.
That's just one of those things. I had a lady in this week. We're going to have to make dentures for her, and the first thing she said is, "My friends have dentures, and it drives me crazy because every time they talk, they click and clack."
Yeah.
And I said, you know what? No worries. We can fix that.
And you know it's driving them crazy,
It is driving them crazy, too. And so we're trying to get the word out there about the implants because 2 to 4 implants on the bottom will lock your lower denture in, and it will not go anywhere.
And you say, I mean, this has been around for quite some time.
Quite some time.
And yet people, just creatures of habit, keep going back to that old way, and you need to look at some of the new procedures. Sure. I know sedation is something that your office does.
Right.
And that depends on the patient as to which procedure, right?
It sure does. So many people, I mean, dentists have not had the greatest. I mean, if you watch any television show, you know, we get beat up pretty badly.
It goes back to cartoons when we were kids, and Bugs Bunny, and these drill sounds.
Well, Dan, it's not a personal thing, you know.
It's come a long way. I mean, dentistry. I mean, it was in the beginning. It was a pretty brutal thing. I mean, you know, way back in the day, you know, there was no anesthetic. You pulled a tooth. You had people that held people down to pull teeth. It's gotten so great, but you know, there's older populations, and we remember the way things used to be. Nobody wants to go running into the dental office anymore.
The worst pain at a dentist office is in your head.
It sure is.
Because you hear the noises, and so that's why sedation is there.
Sedation is there because it's, you know, I always say, come in, go to sleep, you wake up, you're finished. And you have less stress, you have less post-op pain because you didn't sit there and go through the stress of it. Like you say, you know, the noises, you know, the pressure, what's going on in my head sort of thing, you know, is all gone.
Well, and that's all the more reason to start kids out early with cleanings and inspections and, you know, examinations, what, at 3? 2, 3?
2 to 3. When those teeth start coming in, that's the time to start, you know, keeping them clean. And we like to, you know, bring them in, get them introduced, let them ride in the chair, you know, see, you know, that, you know, it's not a bad thing. The most time a child gets, you know, things put in their head, other children that have had a bad experience, or the parents who come in and they've had the bad experience and they put that off on the child.
Well, and kind of like your ad, which I love, people wait a long time.
They sure do.
So, and they don't want to come, maybe because they had a bad experience 20 years ago, and now they wait, and there's a lot of work to do if you wait 20 years.
Yes.
Not that it's going to hurt, but see, they don't know any better than
We've
what they
learned
knew
and we
20
never
years
forget.
ago.
So,
Well, sure.
yeah.
That's right.
All right. Now, I want to talk about something that's not dentistry, but you do as well in your office. And it's something I haven't had the nerve to do yet, so go ahead, talk me into Botox.
Botox.
Talk to me. I am the typical person afraid of this.
The greatest thing about Botox is everybody wants to look youthful. And Botox is just one of those wonderful things of, if placed by the right person, placed in the right places, it literally just smooths our foreheads out. I had a little bit extra left over one day. I Botoxed myself.
Did you really?
I sure did. And it's starting to wear off. You get about 3 months out of it. But, you know, I got tired of that wrinkled forehead. My dad always had that wrinkled forehead when I was a little kid. I thought, well, that's cool. I can't wait to get that.
But I don't look at you
Well, you
and
look good,
think,
your
I don't look
forehead.
at you and say, oh, he's had work.
Yeah, but your forehead
that's
looks
exactly
25.
what
Which, by the way, is rude to say. Can I add that?
Dan, your
And that's
forehead
what you
looks
want.
25 and your chin looks 112.
Oh,
that's
stop,
the problem.
stop.
I'm kidding. But your forehead looks great.
Well,
I mean, you really did.
Yeah. And, you know, and people they've told me, you know, you look younger, you look happier, you look different.
Right.
And the whole point is so that you don't. One of the things with people with Botox is they always get that Spock look. If not placed in the right direction, it will affect the eyes and the eyebrows go up.
Yes.
That's the giveaway. And the most important thing is having somebody like me who knows where to place it, who knows the muscles. You place it in the right direction, and it just smooths out, and it feels, you know, it feels different at first. But I found myself to be more relaxed, and one of the greatest things, my headaches are less.
Well, they use
Really?
they do use Botox to treat migraines.
We use Botox. You know, that's one of the one of the benefits that we do use it for is for treating migraine headaches for people who truly are suffering.
Right.
We relax those muscles.
Well, we think of side effects as being bad, but that's a good.
That's a very good side
isn't
effect.
it?
Yes.
All right. So you also do that in your office.
We do.
Is there a consultation before that? Is it just show up and?
Show up and we'll discuss the process with you. My number one thing is, what do you want? You're here for me. What do you want me to do for you? And I make sure that I know your expectations so that I can meet your expectations.
Okay.
So consultation's in order.
A consultation
free
is always in order. Yeah, because I want to know what you want, and I want to make sure that you get exactly what you want.
Yeah.
So.
Okay.
Yeah.
So you kind of tailor it to suit them.
Absolutely. That's what it's all about.
And there's no cost to talk
Well,
about.
thank
No
you
cost
so
to talk.
much.
Well, that helps.
We appreciate
That's
it.
good. Dan, where are you located?
1330 North Pleasantsburg Drive. Believe it or not, 22 years this year. 22 years.
In Greenville.
In Greenville.
And you don't look like it.
I was a young man once. So.
You
See
have,
that it's a Botox. I was setting you up for it.
you have the forehead you had when you came here.
That's
I
right.
probably did.
22.
22 years ago.
Your head looks 22 years younger. Your forehead.
We're going to talk about a special mission trip. Isn't it wonderful that people feel it in their heart to do that?
Yeah, and there's some things you need to know about it. If you're planning to go on a mission trip, we're going to tell you about that. Stay with us.